Hi, I'm Darrell Lee, EMS Manager for the Oakland Fire Department. I'm here to talk about the N95 mask. So this is the N95 mask that you've been issued, and it has basically two rubber bands that fit around your head. When you start out, take your mask and go ahead and take the rubber bands and put it to the front. As you put it over your mouth and nose, what you're going to do is fit it to your face. Like this. When you take the rubber bands, you're going to do one low and one high. Now we're going to pinch the nose so you have a nice tight seal and conform it to your face, and it should look like this. Now if you're going to take off your mask, what you're going to do is do the opposite. Reach for the rubber band. Now you take it off. To properly dispose of it on a regular, everyday use, you can just go ahead and throw it in the regular trash. Now, if you have somebody who has respiratory illness or you have a potential COVID-19 patient, what we want you to do is put it in a plastic bag, tie it up, and then properly dispose of it in your regular garbage. How do you store this on an everyday basis when you're carrying it? The best way to do it is put it inside a Ziploc bag and then keep it inside your duty bag or inside your personal gear that you have, and then you're ready to pull it out at any time that you need it. So these masks should be used anytime you have somebody who is coughing, sneezing, has high fever, and anytime that you have suspected that they have some sort of respiratory illness, such as pneumonia, asthma, where they're having difficulty breathing. So that's when you want to use these masks, because you don't know if they're a potential COVID-19 patient. The mask is reusable for everyday use. So people that are not contagious, so you may go to a call that you're normally talking to somebody that you're making contact with, those people may not have COVID-19, and you can reuse those masks again. But anybody who has a respiratory ailment that is coughing, sneezing, or flu-like symptoms, those are the ones that you want to dispose of those masks and then get a new one. You put it on, let it air dry for a while. Right now what we're recommending is probably a good half an hour to an hour so that it dries, because as you're using this, your exhalation of your breath is moisture on the inside of this mask. So you want to allow that to dry and then go ahead and place it back in your Ziploc bag again and put it back in your duty bag and ready for the next use.